Homeopathic treatment of EDV, Ebola virus disease, or Ebola hemorrhagic fever. It's a viral acute infectious disease with 50% to 90% of lethality. The Ebola virus was first described by David Finkes in 1976 in two simultaneous outbreaks, one in Zara, Sudan, and the other in Yambuku, Democratic Republic of the Congo, which is close to Congo River. This is a map where they are located. And this is Ebola's origin and distribution. There are 5 distinct families of Ebola viruses. And this is its structure. The virus may be acquired upon contact with blood or bodily fluids of an infected animal or person: chimpanzees, gorillas, bats, monkeys, antelopes, porcupines, and pigs. Needles, syringes, etc. The majority of cases in humans have occurred as a result of human-to-human transmission through broken skin or mucous membranes with the blood of other bodily fluids or secretions. Stool, urine, saliva, semen, or infected person, soiled clothing, used needles, bed linen. Air is not a contagious mean. Fruit bats are the natural source of the Ebola virus. The virus replicates inside the bats, but it doesn't kill them. The incubation period is from 2 to 21 days. The autopsies of the victims are prohibited by the high risk of contagion. The corpses are incinerated. The symptoms are produced by the injury of the virus on the vascular endothelium, the hepatocyte, renal, and adrenal cells. The virus of the Ebola blocks the immune response of the dendritic cells, invading thus the whole organism. Of that way does it. It was discovered by Dr. Gaya Amarashinge of the Washington University. The plasmacytoid dendritic cells, PDC, are one rare subtype of dendritic cells that are in the blood are in the lymphoid peripheral organs, and they are a part of immune innate system which allows to detect viral and bacterial nucleic acids, and they produces big quantities of interferon, which is antiviral. When there is an infection, many proteins called interferons are activated. In our case, the interferon type 1 is activated. Normally, when it brings in a virus, it goes towards to the dendritic cells, which to perceive the aggressor, forming antigens in their surface, which are recognized and destroyed by T lymphocytes, preventing the spread and viral replication. The interferon is a messenger who informs the invasion to the dendritic cells. Through an intermediary protein, so-called state 1, the interferon gives a phosphate group, phosphorylation, to one of the amino acids of the state 1 called tyrosine, so that the state 1 is activated. So that the intermediary state 1 activated be able to penetrate inside the dendritic cells is necessary a carrier called kPNA, who will allow to the state 1 to cross the cellular membrane. When the state 1 is phosphorylated, activated, it joins to the kPNA and penetrates in the dendritic cells and directing to the N array of the nucleus, where there liberates the message which activates all the expressions of the genes necessary for the antigens antiviral superficial response that being recognized by the T lymphocytes, they destroy the dendritic cells with the invader inside. But the Ebola virus possesses a lethal weapon. The lethal weapon of the virus is the VP24 protein. The virus of the Ebola prepares his most lethal weapon, the VP24 protein, which blocks the immune system of the organism, and then it demantles all blood vessels, veins, arteries, and capillaries. When the Ebola virus infects to the dendritic cells, the VP24 protein of the virus joins to carrier kPNA in the same place that does it the state 1. The VP24 competes to the state 1 and it wins. It enters to the nucleus of the dendritic cells. Since it takes another message, the immune response stops immediately, and the virus begins to replicate indefinitely. The viral particles are spread by the circulatory stream and infect the macrophages, which begin to produce and to liberate coagulation factors, forming an intravascular massive coagulation, which is demonstrated on the skin as a bloody eruption. The clots produce a blood deficit to the parenchymas, with a consequent suffering due to the hypoxia, and they enter an insufficiency, liver, kidneys, etc. The macrophages also produce other inflammatory substances that destroy the vascular endothelium, making to increase the vascular permeability, with the consequent appearance of internal and external hemorrhages. The virus also attacks the intestines cells, producing serious dehydration diarrheas. It also injures the liver, kidneys, and adrenal and glands cells. The oxygen doesn't come to the cells and the patient dies. Signs and symptoms. Initial signs and symptoms: high fever, prostration, intense myalgias, arthralgias. Abdominal pain, headache, sore throat, backache. Chills, vomits, diarrhea, stomachache. After 7 days, the state period appears serious. High fever with hemorrhagic eruption on the whole body. Watch carefully the lesions on the skin. Hemorrhages in the alimentary canal, hematemesis, melena, enterorrhagia, otorrhagia, ocular hemorrhages. Renal insufficiency, hepatic insufficiency, conjunctival injection and conjunctivitis. Swelling of the scrotum and vulva, redness of the palate, coma. Disseminated intravascular coagulation, hypovolemic shock. The patient dies due to the hypovolemic shock and renal and hepatic insufficiency. Fever, intense heat. Generalities, weakness, heat during. Extremities, pain during heat. Abdomen, pain in general. Abdomen, pain, heat during. Head, pain, heat during. Internal throat, pain in general. Internal throat, pain, heat during. Back, pain. Lumbar region in general. back pain during fever, fever, chills with in general, stomach, vomits during heat, rectum, anus, perineum, diarrhea in general, stomach pain in general. Repertorial frame of the initial period of the Ebola in my repertory. First of all, Arsenicum album and Nux vomica, following by Rustox, Natrium muraticum, Belladonna in second place. In third place, Bryonia, Pulsatilla, Phosphorus, Sulfur, and Lycopodium. Conclusions on the epidemic genius of the initial period of Ebola. Taking the 14 mentioned symptoms, the following 5 medicines prevail: Arsenicum album, Nux vomica, Rustox, Phosphorus, and Lachesis. Repertorial place of the symptomatology of the Ebola serious period. Symptoms. Symptom 1, fever, intense heat. Fever continued, hemorrhagic on skin or mucous membranes. 3, fever continued, petechial, purpura with. 4, in my repertory, this is a part dedicated to the clinic and nosology. Purpura, hemorrhagics on the skin, mucus, and or cirrhosis. Generalities hemorrhagic, orifices of the body from clinic thrombosis. Skin, eruptions, blister, filled blood. 8, skin eruptions, vesicular black. 9, skin eruptions, vesicular blood filled with. 10, skin eruption, vesicular red. 11, skin gangrene, cold. 12, clinic nosology, gangrene in general. 13, mouth, hemorrhage. 14, rectum, hemorrhage. 15, air, secretions, blood. 16, eyes, hemorrhage, eyes, bleeding from. 17, eyes, injected. 18, eyes, inflammation, conjunctival. 19, clinic, uremia. 20, kidneys, suppression of urine. 21, clinic, acute hepatitis. 22, clinic, hyperacuity, fulminant hepatitis. 23, mouth, hemorrhage, palate, purpura. 24, mouth, discoloration rate, palate. 25, female genitalia, swelling vulvae. 26, male genitalia, swelling scrotum. 27, mind, unconscientious, coma in general, unconscientiousness. 28, mind, unconscientiousness, coma, collapse, shock with. Repertorial frame of the serious period of Ebola taking the previous 28 same symptoms. First of all, lachesis. Second, phosphorus. Third, arsenicum album, crotalus horridus. Fourth, belladonna. Conclusions on the homeopathic epidemic genius of the serious period of Ebola. Taking the 28 mentioned symptoms, the following 5 medicines prevailed. Lachesis, first of all. Second, phosphorus. Third, arsenicum album. Fourth, clotalus horridus. Fifth, secale cornutum. Differential diagnosis. The difference between lachesis and phosphorus is that the last one doesn't possess neither red or black blisters or vesicles filled with the blood on the skin, nor the red discoloration of the palate. Lachesis does. Consider carefully these 3 symptoms to differentiate them. Lachesis doesn't have otorrhagia. Arsenicum album doesn't have internal hemorrhages, neither by ears nor by eyes and orifices of the body. Clotalus horridus doesn't have neither uremia nor swelling of the genitalia, but it will be of big utility if there was a fulminating hepatitis with coma. Secale cornutum is not a medicine for hemorrhages by the orifices of the body. It doesn't have neither serious renal insufficiency, neither serious acute hepatitis. It would be indicated if the blisters filled with blood predominate and the patient has cold surface with internal burning with desires to discover the body. Conclusions. Lachesis, phosphorus, arsenicum album, clotalus horridus, and secale cornutum are the main medicines for the prevention and treatment of Ebola. In homeopathy, the similarity also is fulfilled considering the morphology of the medicine in its natural state with the morphology of the pathology. Watch carefully the morphology of the pathology and the morphology of the medicines that can cure Ebola. Posology. In liquid form, the complex 30CH or 200 CH or K or FC. 10 drops on the tongue every hour during the 2 first days, then to be spreading. Thank you very much.